What has gone wrong in the medical field? Where is the do no harm oath upheld? Why is the system so screwed up? Why is there an overall tendency for doctors to not actually listen to their patients? I don't get it. So an example of that is very close to my heart right now is I have a close relative that had an important meeting a few days ago to discuss the complications that have arisen after open heart surgery, where she now has a hernia that she has to deal with. And this relative got some very upsetting replies from the doctor, which I have heard many patients get over the years. And one of these replies was along the lines of, "I'm not interested in the heart. If you have any questions about the heart, then you have to go to a cardiologist. I'm only and only focused on the hernia." And then when my relative didn't get answers to her questions further on in the talk, and she wanted to describe her own experience of what is happening in her body and the complications that are arising, the doctor said something along the lines of that he's not interested in any of her findings or what she's feeling at all in her body, because if it's not in the journal that she came with from the former doctor that referred her to this doctor and it hasn't been written down, then he's not taking it into consideration. And you have to bear in mind that this relative is a nurse of over 30 years experience in the medical field, and she really knows what she's talking about. So the doctor didn't want to listen to the patient. They didn't want to listen to their experience and finding of what goes on in their body. They only wanted to look at lab results and test results. And they were not interested in seeing a holistic picture of the problem because they were not specialized, because rather they were only specialized on one thing only, just one thing. And I know that there will be some of you who have had a very fortunate experience in the medical field, and thank goodness for that. I'm very happy for that. But the vast majority of us will be falling through the cracks, pushed from one doctor to the next, like these small, almost like these small compartmentalized lab rats. What are your experiences with the conventional medical field? Has it been positive or a real downer? Has it been a bit of both? I would really like to know, because in my entire surroundings, it's mostly been negative. So if there are good, positive experiences, great, share them. If they're negative, share them. I would really like to hear your thoughts and maybe your suggestions on what you think would be a great idea to improve the system so that less patients feel pushed around without anything to show for it. Let me know in the comments below.